In this presentation, we're going to be discussing why you exercise, taking your pulse, exercise basics, signs of overexertion, home exercise, and exercising in hot or cold weather. Why do we exercise? Regular exercise will help prevent heart disease, decrease blood pressure, heart rate, and respiration. It will improve your cholesterol levels and can decrease stress and depression. It also increases your strength, flexibility, endurance, balance, confidence, and self-esteem. Taking your pulse. There are several locations to take your pulse: your wrist, ear, temple, and neck. We don't want you taking your pulse on your neck. If you press too hard, you'll decrease the blood flow to your brain. We recommend that you take your pulse on the thumb side of your wrist with the tips of your fingers. Everyone's pulse is different, and you may have to vary the pressure you use to find your pulse. Be patient. Keep the fingers in place for at least 5 seconds before moving to a different location. Once you find your pulse, count to 10 seconds starting with 0 and multiply by 6. You may feel a skip in your beat. This might be normal for some of you. It is good to become familiar with our pulse so that you can recognize irregularities. Exercise basics. Your exercise workout consists of warm-up, aerobic exercise, strengthening exercise, and cool down. A minimum of 5 minutes of walking to warm the heart up and get it pumping is good practice. Do your stretches and remember to hold them for 20 seconds. Why do we warm up? When you start to exercise, your heart muscle requires more blood because it is beating faster. You want to gradually expose your heart to the exercise. If you don't warm up properly, you might not be getting enough oxygen to the heart muscle at the start of your exercise session. Aerobic exercise makes you breathe harder and sweat a bit. Most of your workout should consist of aerobic exercise. It uses oxygen for energy. It also uses the major muscle groups when on the treadmill, bike, new step, stepper, elliptical, and rowing machine. When you are doing aerobic exercise, it is normal for breathing to become deeper and faster. Your heart rate will go up, your blood pressure sometimes goes up, but usually goes down. Arteries will widen and dilate, and you will sweat. Anaerobic exercise uses smaller muscle groups, and all you need is 1 to 3 minutes of high intensity for it to be beneficial. This type of exercise will increase your heart rate and blood pressure. You may feel mild muscle aches or burning that will resolve quickly after stopping. You may feel more tired with anaerobic exercise than with aerobic exercise. It is just as important to cool down as it is to warm up. If you don't keep moving while your heart rate is high, you can experience blood pooling, low blood pressure, dizziness, or lightheadedness. You need to cool down for a minimum of 5 minutes to gradually return your heart rate to your resting rate. Repeat stretching to work on improving flexibility. Home exercise. We encourage you to exercise at home. Exercise at a similar or slightly lower exercise level compared to cardiac rehab. Try to stay active all 7 days of the week. Walking is a great way to stay active between your cardiac rehab sessions. The Surgeon General recommends at least 30 minutes of moderate to intense activity on most days of the week. Signs of overdoing it may include pain, shortness of breath, fatigue, dizziness, or lightheadedness that doesn't resolve with rest. The Talk Sing test is an easy way to set a good pace for your exercise routine. Try talking during your exercise. If you can carry on a conversation, you're exercising at about the right rate. If you're too out of breath to talk comfortably, slow down. When exercising outside in hot or cold weather, your heart works harder. Your pulse rate may be higher, and you are more likely to have symptoms of chest pain and shortness of breath. Reduce the intensity of exercise under these conditions.